Welcome back to our colonoscopy preparation podcast series. I am Bimal Maharjan, your guide through these pivotal days as your procedure approaches. As we enter T minus 5 days, our focus intensifies on fine tuning your medication regimen. Remember, Godsphere is not a healthcare provider or a clinical firm. We provide self-help gastrointestinal care tools and resources intended to empower you in managing your health, complementing, not replacing, professional medical advice. Always consult with a healthcare professional for medical concerns. Our series is designed to guide you through each stage of your colonoscopy preparation with detailed, actionable advice. Today, at T minus 5 days, we focus specifically on the crucial adjustments needed for your medications, ensuring everything is perfectly aligned for your upcoming procedure. In our last episode, we discussed the adjustments necessary at T minus 7 days, emphasizing medication management and logistical planning. While T minus 5 continues on this theme, today's focus shifts more narrowly to ensuring your medications are perfectly calibrated to minimize any risks during your colonoscopy. This episode builds on the previous discussions but dives deeper into the specifics of medication timing and emergency planning. In today's episode, we'll explore the precise adjustments you should make to your medications, including how to manage over the counter meds and prescription drugs in the days immediately leading to your colonoscopy. We'll provide detailed examples of how to adjust common medications such as insulin, blood thinners, and anti inflammatories, and discuss the critical importance of coordinating these changes with your healthcare team. We will also cover how to handle emergency medications on the day of the procedure, ensuring you are prepared for any situation. Stay with us, and by the end of this episode, you will have a clear, actionable plan for managing medications in the final days before your colonoscopy. We are here to help you navigate these adjustments with confidence, ensuring a smooth and safe procedure. So let's begin in our general Q&A format. The question number one is, which medications should I adjust and how as I approach the colonoscopy date? The answer is adjusting medications correctly is essential to minimizing risks such as bleeding, electrolyte imbalances, and interactions with anesthesia. Here is a focused approach to managing your medications. Blood thinners, for example, warfarin, clopidogrel, aspirin. Most patients will need to start taking these medications 5 to 7 days before the procedure to reduce the risk of excessive bleeding. Your healthcare provider might replace them temporarily with a different form of anticoagulation, often referred to as bridging therapy, depending on your risk of blood clots. Diabetes medications such as insulin, metformin, sulfonylureas. Adjustment: insulin doses may need to be reduced to accommodate the changes in your diet during the bowel prep. Oral medications such as metformin might be paused on the day before and the day of the procedure to prevent complications such as lactic acidosis, especially since you will be fasting. 3. Anti-inflammatory drugs such as ibuprofen, naproxen. Adjustment: these should generally be discontinued several days before the procedure to decrease the risk of gastrointestinal bleeding. ACE inhibitors and ARBs such as lisinopril, losartan. These medications might be paused on the day of procedure, particularly if you are instructed to restrict your fluid intake to avoid low blood pressure during anesthesia. And other medications, such as for heart, lung, thyroid, or psychiatric conditions, continue as prescribed unless specifically advised otherwise by a doctor. And obviously, some of us take herbal supplements and vitamins. For example, vitamin E, fish oil, ginkgo biloba. These should be discontinued at least a week before the procedure to reduce the risk of bleeding. And obviously, remember, it's crucial to have a detailed discussion with your healthcare provider about each medication you are taking. Provide them with a comprehensive list of your medications, including over-the-counter drugs and supplements, so they can guide you on which specific ones to adjust and how to do so safely. And in episode T-7, we gave you a detailed overview about what to do and what not to do. And T-7 days, you should have a consultation with your healthcare provider. And in T-5 days, it's about implementing these medications. And we are going to go one more time because it's that important to make sure all the medications are paused or continued because your safety is extremely important. And let's move on to question number 2. How should I manage over-the-counter medications I typically take for pain, allergies, or sleep? For pain medications, the typical over-the-counters such as aspirin, ibuprofen, naproxen, it is NSAIDs. So ideally, by this time, you should have stopped taking NSAIDs. It's generally advised to take at least stop 7 days in advance. So we also talked about that in a previous episode as well, because NSAID, you need to stop taking NSAID at least 5 to 7 days before your colonoscopy to reduce the risk of bleeding. If you need pain relief, acetaminophen, the Tylenol is a safer alternative as it doesn't have the blood thinning effects of NSAIDs. Allergy medications, antihistamines like loratadines, cetirizines, and diphenhydramine, Benadryl. Most non-sedating antihistamines can be continued as they do not affect the colonoscopy. However, if you use sedating antihistamines like diphenhydramine, consider consulting with your healthcare provider as these can interact with the sedatives used during the procedure. Sleep medications. Typical over-the-counter melatonin, diphenhydramine-based sleep aids, Tylenol PM. The management is, if possible, avoid taking these sleep medications. Typical over-the-counter melatonin, diphenhydramine-based sleep aids, such as Tylenol PM. Management, if possible, avoid taking sleep medications the night before your colonoscopy. Sedative ingredients, particularly in diphenhydramine-based products, may enhance the sedative effects of anesthesia drugs used during the procedure. If sleep is a concern, discuss non-medication strategies with your doctor or consider using melatonin, which has fewer interactions. So in conclusion, the proper management of the over-the-counter medications is a critical aspect of preparing for colonoscopy. By carefully adjusting your intake of pain relievers, allergy medications, and sleep aids, you help ensure a safer procedure with a minimal risk of complications. Always consult with the healthcare provider for personalized advice tailored to your specific needs. Heart conditions. Question number 3. Should I make any dose modifications to my heart medications, including blood pressure and heart rhythm meds? When preparing for a colonoscopy, it's essential to maintain stable heart function and which often depends on consistent medication. Here is how to approach any necessary adjustments. Blood pressure medications. Typical medications such as ACE inhibitors, beta blockers, diuretics, calcium channel blockers. The management, the generally you should continue taking your blood pressure medications as usual to maintain cardiovascular stability. However, some medications like diuretics, which affect fluid and electrolyte balance, might need to be adjusted to prevent dehydration due to the colonoscopy prep. Heart rhythm medications. Typical medications, anti-arrhythmics such as amiodarone, digoxin, and typical management, these medications should generally be continued without alteration to avoid any potential for arrhythmia. However, these specific conditions of your heart health might necessitate adjustments, which should be done under close medical supervision. And if applicable, anticoagulants. Typical medications, warfarin, direct oral anticoagulants such as DOACs like apixaban or dabigatran. The typical management is modifications or temporary cessation might be required depending on risk factors for thrombosis versus bleeding. Bridging therapy with heparin could be necessary if stopping anticoagulants. And the action for you is three-step action. Number one, contact your cardiologist. It is crucial to consult with your cardiologist or healthcare provider who manages your heart medications well before your procedure date. They can provide specific instructions based on your cardiovascular health and the medication and the type of medications you are taking. Two, pre-procedure consultations. In T minus 7 days, we talk to you about having a pre-procedure consultations. Please, we assume that you have done that. And if you haven't done that, we remind you to discuss your entire medication regimen, including any over-the-counter drugs or supplements that could interact with your heart medications. Three, medication list review. Bring a complete list of your medications to your consultation. This list includes all prescription medications, over-the-counter medications, supplements, along with their doses and how often you take them. Adjusting your heart medications in preparation for a colonoscopy is a delicate balance designed to maintain your heart health and prevent procedural complications. Direct communication with your cardiologist is a crucial to tailor these adjustments to your specific needs, ensuring a safe and a successful colonoscopy outcome. So let's move on to the kidney conditions. The question here is, are there specific considerations for adjusting medications if I have reduced kidney function or AM on dialysis? For those of you managing kidney conditions, obviously it's crucial to adjust your medications in a way that accommodates your reduced kidney function or dialysis schedule. Kidney health specifically impacts you how your body processes medications, including those used for colonoscopy prep. So I have three general adjustment guidelines. Number one, water-soluble medications. These may need doses adjustments or timing changes to prevent accumulation in the body, particularly if your kidney function is compromised. Two, electrolyte imbalance. Medications that affect electrolyte levels must be managed carefully to avoid imbalances that could complicate both your kidney condition and your colonoscopy procedure. Number three, dialysis patients. Timing your medication around your dialysis sessions is essential as some medications might be removed or their effectiveness reduced by dialysis. So I have two actions for you. One, consult with nephrologist. It's imperative to discuss all your current medications with your nephrologist who can make specific recommendations based on your level of kidney functions and dialysis needs. Again, two, medication review. Bring a list of your medications to your appointment, including the over-the-counter drugs and supplements to ensure all aspects of regimens are considered. Let's move on to the liver conditions. How do liver conditions like cirrhosis influence any medications adjustments for the colonoscopy? Again, if you are dealing with a liver condition such as cirrhosis, the liver's ability to metabolize medications can be significantly impaired, affecting both the efficacy and safety of the drugs you take. And I have two adjustment guidelines for you. One, reduce metabolism. Medications that are heavily metabolized by the liver may require dosage adjustments to prevent toxicity. And two, bleeding risk. Cirrhosis often leads to increased bleeding risk, which is crucial to manage when preparing for procedures such as colonoscopy. And I have two actions for you. One, liver specialist consultation. Your hepatologist should review your medications to adjust doses or change prescriptions as necessary. Two, special precautions may be needed to avoid bleeding risk and possibly adjusting or temporarily stopping medications that can exacerbate bleeding. Let's move on to the diabetes management. Question number 6. What changes are needed for my diabetes medications, especially if I am on insulin or medications such as Metformin or Ozempic? The diabetes medications are crucial as you approach your colonoscopy date, particularly because your food intake will be altered significantly. I have two adjustment guidelines for you. Number one, insulin. You may need to reduce your insulin doses to prevent hypoglycemia due to decreased food intake. Two, oral diabetics. Medications such as metformin should be reviewed. Metformin is typically paused the day before the procedure to prevent any risk of lactic acidosis, especially as your intake of fluids and solid changes. So I have two action items for you. One, endocrinologist review. Have a detailed discussion about your insulin regimen and oral medications in the days leading up to the colonoscopy. Two, adjust as necessary. Your healthcare provider may recommend adjusting the timing and doses of your diabetes medication to match your prep diet and fasting schedule. Let's move on to respiratory conditions. Question number 7 is, should I adjust my asthma or COPD medications prior to the procedure? We have already talked about this in T-7 that you should. And for those with asthma or COPD, maintaining respiratory stability is crucial, especially right before medical procedures like a colonoscopy. So I have two adjustment guidelines. One, inhalers and bronchodilators. Typically, you should continue using your inhalers and bronchodilators as normal to ensure that your breathing is not compromised. Two, systemic steroids. If you are on a systemic steroids for COPD or severe asthma, these might need adjustment as they can affect immune function and healing. And I two action items for you. Again, consult your pulmonologist. It's essential to discuss how to use your respiratory medication leading up to the procedure, particularly if you are under sedation. Two, medication review. Bring a list of all respiratory medications to your appointment to ensure all medications are accounted for in your pre-procedure plan. Let's move on to autoimmune disorders. Do medications for autoimmune disorders require adjustment before colonoscopy? Adjusting medications for autoimmune disorders such as rheumatoid arthritis or lupus is vital to manage inflammation and immune response during a colonoscopy. So I have two adjustments, two guidelines. One, immunosuppressants. These may need to be reduced or temporarily halted to balance the risks of infection and inflammation. Non-steroidal anti-inflammatory drugs, NSAIDs, often used in autoimmune disorders, these should generally be stopped several days before to reduce bleeding risk. I have two action items for you. Specialist consultation. Review your treatment plan with your rheumatologist or immunologist to ensure your autoimmune condition is managed appropriately during the colonoscopy preparation. Two, safety and efficacy. Ensure you understand the implications of any changes in your medication regimen, particularly how they might affect your recovery from the procedure. So let's move on to the mental health conditions. And question number 9, can I continue my mental health medications such as antidepressant, anti-anxiety, or mood stabilizers? Obviously, maintaining a mental stability is just as important as physical health when preparing for a procedure like colonoscopy. I have two assessment guidelines: antidepressants and mood stabilizers. Generally, you should continue these medications without interruption to avoid withdrawal symptoms or destabilization of your mental health. Two, anti-anxiety medications. Some sedative anti-anxiety medications may need to be adjusted due to potential interactions with anesthesia drugs used during the colonoscopy. So I have two action items for you. Mental health provider review. Discuss any potential interactions with anesthesia and whether doses need adjustment. Two, continuous care. Ensure there is a plan for post-procedural mental health care, especially if changes to your medications were required. Let's move on to the supplements and herbal adjustments. The question is, which supplements, vitamins, or herbal remedies should I pause and when? As we refine our focus on medications, let's not overlook the impact of supplements and herbal remedies. So I have two adjustment guidelines. One, blood thinning supplements such as fish oil, vitamin E, and ginkgo biloba should be paused as they can increase bleeding risk. Herbal remedies such can interact with anesthesia or medications used during the procedure such as St. John's wort or valerian root. Action. Comprehensive review. Include all your supplements when discussing your medication management plan. And safe cessation. Determine the right time to pause these supplements to minimize any impact on procedure or your recovery. Now let's move on to the emergency medications. What emergency medications, example for angina, asthma, should I have on hand, and how should I use them if I need it? Again, it's also crucial to prepare for any emergencies by properly managing medications needed in urgent situation. Again, this is a backup plan, preparing for the worst, and obviously hoping for the best, which is a safe colonoscopy, but sometimes being ready for the emergency medications can give a peace of mind. So I have two adjustments for you. One is readiness. Keep emergency medications such as nitroglycerin or for angina or rescue inhalers for asthma readily accessible. Instructions. Ensure you and anyone assisting you are clear on how to use these medications if an emergency arises. Again, two action items for you. Pre-procedure communication. Inform the medical team of all emergency medications you have, including where they are stored and how they should be administered. Two, review and practice. Familiarize yourself and caregivers with the use of these medications under stress to ensure quick and correct uses. And T minus 5 days is you should do a final check on all medications. You should compile a comprehensive list of all medications, including doses, timing, and review it with your healthcare provider to confirm medication plan for the days leading up to your colonoscopy. Because if you miss to adjust your medications, then there is a risk for rescheduling and canceling. For example, if, if you don't forget to take blood thinning medications, they can do a colonoscopy and they can remove polyps if they found it it can because because the risk of bleeding. So T minus 5 days is the final check where you should check medical adjustments and implement medical adjustments. So, as we close today's episode on medication adjustment for your upcoming colonoscopy, there is one critical step we need to ensure: the final check of your medication list. This step is paramount to safeguarding your health and ensuring the procedure goes smoothly without any medication related complications. The final check involves compiling and reviewing a comprehensive list of your medications. This isn't just a formality, it's a crucial component of your pre-procedure medication. It helps your healthcare team understand exactly what you are taking so they can make informed decisions about what needs to be paused, adjustments, or continued right up to the day of your colonoscopy. So I have three action steps for you. One, compile your medication list. So details to include are list every medications, including the over-the-counter drugs, prescriptions, herbal supplements, and vitamins. For each item, note the dose, the timing of your doses, and any special instruction associated with them. Two, consult with your healthcare provider. The purpose is to review each medication with your doctor or pre-procedure nurse who specializes in preparing patients for surgery and procedures. This review is critical to identify any potential interaction with anesthesia or the procedure itself. And outcome, your provider may be given the green light to continue some medications up to the day of the procedure or might adjust doses to prevent interaction or side effects. And the third final step is documentation. Update your list. After the consultation, update your medication list based on the feedback from your healthcare provider and keep it accessible. Make sure this updated list is easily accessible. Bring a copy the of on the day of your colonoscopy and consider having a digital copy available on your phone or a health app. So in order to make this actionable, we have added two resources. One is T-5, the final check user guide that should help you go through everything that's necessary. For example, we have a medication adjustment action plan user guide, which has a category, medication type, reason for adjustments, and action required and specific instructions. For your quick review, you can take a printout or place it in your refrigerator for a quick access. And two, to make this plan actionable, we have prepared a final checklist, which has you can we can tick mark a yes or no, and it also has special notes on it, so that it's easier for you to review these meds, doses, and timings, and also make sure that you can track and monitor these changes with this user guide and the checklist. So taking the time to thoroughly review and update your medication list with your healthcare provider is not just about following protocol. It's about taking active steps to ensure your safety. As you complete this final check, you're setting the stage for successful and complication-free colonoscopy. Remember, each medication you take has the potential to affect the outcome of your procedure, and being proactive in managing these details is crucial. Thank you for tuning in today's episode. Next time, we'll delve into T-3 days, which we talk about adjusting your meal, which is the low residue diet. That episode will also be packed with vital information to help you navigate the last crucial steps before your colonoscopy. Stay preferred, stay informed, and I'll see you in the next episode of our colonoscopy preparation podcast series. Until then, take care of yourself and keep that medication list updated and reviewed.